a word of caution when looking at muscle weakness and giving you a bigger picture approach regarding muscle and fascia. So very often when a client comes to see us, right, they have a chronic pain issue. That's what we specialize in. And they will even tell us that one of their legs or one of the sides of their body tested, or their arms, tested weaker than the other. And of course, if it tests weak, what do we do, right? Something's weak, well, we must strengthen it. And they'll also then tell me that when they tried to strengthen it, right, they actually had more pain and they got worse. So is it weak? I want you to really be cautious when assessing locally. So I want you to imagine, right, if I am restricting Aaron over here, right, then there's a tremendous amount more compression on his right side. His right leg, literally, its center of gravity is shifted over, is working a lot more throughout the entire day, no matter what, walking and standing, okay? So in this pattern, what can happen is if I don't look at this and I just test leg strength, muscle strength on the left and the right, I'll be like, oh my God, his right leg is weaker than his left. But is it weaker or is it exhausted? So let me show you a very simple way of understanding it. And we're just going to demonstrate this at the bicep. So go ahead and bring your arm like this, Aaron. Good. And we're going to use something, a phone, right, that we all have. And I'm just going to put the phone here. And I want you to imagine what would happen to Aaron if I asked him to keep his arm in this position, just like this, just holding the phone, weighs nothing, the entire day, just like this, just one day. Do you think at the end of that day that this bicep is not going to be slightly pissed off? Do you think at the end of that day, if I tested this bicep, would it score strong or would it score weak? So don't be fooled when you are looking at your, right, as a therapist, when you're looking at your patients, at your clients, or when you're trying to assess yourself, you're at the gym and, oh my God, my leg feels weak, I should strengthen it. Please go get your myofascial system assessed so that you can make sure you're not feeding a problem.